Hello and welcome. Today, we're diving into a critical gynecological condition, ovarian torsion. This is a painful and potentially serious issue that requires prompt medical attention. We'll explore what it is, why it happens, how to recognize it, and what can be done about it. So, what exactly causes ovarian torsion? The primary culprit is the twisting of the ovary on its supporting ligaments and blood vessels. This twisting often occurs because of an ovarian cyst or tumor, which adds weight and instability to the ovary. However, torsion can also happen in normal-sized ovaries, particularly during pregnancy due to hormonal changes and increased blood flow or strenuous physical activity. Other contributing factors may include hyperstimulation from fertility treatments, pre-existing ligament laxity, or even just sudden movements. Now, let's understand the pathophysiology. When the ovary twists, it compromises the blood supply. Initially, the venous outflow is obstructed, leading to swelling and congestion of the ovary. As the twisting continues, the arterial supply is also cut off. This deprives the ovary of oxygen and nutrients, causing ischemia or oxygen deprivation. Prolonged ischemia can lead to cell death, tissue necrosis, and eventually ovarian infarction, meaning the ovary tissue dies. The release of inflammatory mediators can also contribute to severe abdominal pain. Ovarian torsion is a relatively rare condition, but it's important to be aware of its existence. While it can occur at any age, it's most common in women of reproductive age, particularly those who are pregnant or undergoing fertility treatments. Children and postmenopausal women can also experience ovarian torsion, though it's less frequent. The incidence is estimated to be around 5 to 10 cases per 100,000 women per year. The most prominent symptom of ovarian torsion is sudden, severe abdominal pain, typically localized to one side of the lower abdomen. This pain often comes on abruptly and can be sharp, stabbing, or cramping. Nausea and vomiting are also common, as is a feeling of pelvic pressure or fullness. Some women may experience intermittent pain if the torsion is incomplete, meaning the ovary twists and untwists spontaneously. It's crucial to seek immediate medical attention if you experience these symptoms. Diagnosing ovarian torsion can be challenging as the symptoms can overlap with other conditions. A pelvic exam is usually performed. Ultrasound, particularly Doppler ultrasound, is the primary imaging modality. It can help visualize the ovary and assess blood flow. A decreased or absent blood flow to the ovary is a strong indicator of torsion. CT scans and MRI can also be used, especially if the ultrasound results are inconclusive. Ultimately, the diagnosis is often confirmed during surgery. While we don't have strict classifications for ovarian torsion, it's important to note whether the torsion is complete or intermittent. Complete torsion involves a full blockage of blood flow, while intermittent torsion involves periods of twisting and untwisting, resulting in fluctuating symptoms. The primary treatment for ovarian torsion is surgery. The goal is to untwist the ovary and restore blood flow as quickly as possible. Laparoscopy, a minimally invasive surgical procedure, is usually the preferred approach. The surgeon will carefully untwist the ovary and assess its viability. If the ovary appears healthy after untwisting, it can be saved. If the ovary is necrotic or dead, it may need to be removed via oophorectomy. In some cases, especially if a cyst or tumor is present, it may be removed to prevent future torsion. Prompt surgical intervention is crucial to maximize the chances of saving the ovary. Unfortunately, there's no definitive way to completely prevent ovarian torsion. However, managing underlying risk factors such as ovarian cysts can help. Regular pelvic exams and ultrasounds can help detect and monitor cysts. If you are undergoing fertility treatments, your doctor will closely monitor your ovaries for signs of hyperstimulation. Being aware of the symptoms of ovarian torsion and seeking immediate medical attention, if they occur, is the best way to minimize potential damage. The prognosis for ovarian torsion depends on how quickly it's diagnosed and treated. If the ovary is untwisted within a few hours, the chances of saving it are high. However, if the torsion has been present for a longer period, the ovary may be irreparably damaged. Recent research is focused on improving diagnostic accuracy and developing non-surgical treatments for ovarian torsion, such as medications to improve blood flow. Scientists are also exploring ways to predict which women are at higher risk of developing ovarian torsion. Early intervention is key to preserving ovarian function and fertility.